Good afternoon, Yorktown. Welcome to another COVID-19 update. My name is Supervisor Matt Slater. It is Monday, January 11th, coming to you live from the town boardroom in Town Hall. Today's report is a mixed bag. We have some really good news, and we have some news that frankly isn't so good. But let's start with the good news. The good news is, as we've said before, and we've continued to provide this information, the vaccine continues to make its way within our community. Today, phase 1B was opened up and authorized by the state of New York. So now we have 1A and 1B. So who is able and eligible to receive the vaccine? Teachers and education workers, first responders, public safety workers, public transit workers, all residents 75 and older, high-risk hospital workers, emergency room workers, ICU staff, pulmonary department staff, etc. Residents and staff at nursing homes and other congregate care facilities. Federally qualified health center employees are able to get the vaccine. Our EMS workers, coroners, medical examiners, and certain funeral workers. Staff and residents at OPWDD, OMH, and OASIS facilities. Those are state facilities. Urgent care providers. Individuals administering the COVID-19 vaccines, including local health department staff, all outpatient, ambulatory, frontline, high-risk healthcare workers of any age who provide direct in-person patient care, all staff who are in direct contact with patients, all frontline, high-risk public health workers who have direct contact with patients, including those conducting COVID-19 tests, handling COVID-19 specimens, and the COVID-19 vaccinations. Also eligible, doctors who work in private medical practices and their staff, doctors who work in hospital-affiliated medical practices and their staff, doctors who work in public health clinics and their staff. All registered nurses are eligible. Specialty medical practices of all types, dentists and orthodontists, as well as their staff, psychiatrists and psychologists, as well as their staff, physical therapists are eligible, as well as their staff, optometrists and their staff, pharmacists and pharmacy aides, home care workers, hospice workers, and staff of nursing homes or skilled nursing facilities who did not receive COVID vaccination through the Pharmacy Partnership for Long-Term Care program. So that encompasses 1A and now 1B. So we continue to see the vaccine rollout here in the town of Yorktown in Westchester County and across the state of New York. We had the county executive, George Latimer, join me last week on Friday. He provided some insight into the vaccination rollout. Again, it's that light at the end of this very long tunnel. Doesn't mean we can let up, but that light is getting brighter. The county initially received 500 doses of the vaccination. They received an additional 300 from Montefiore, and that is their allotment at this point in time for both 1A and 1B, as you heard. So obviously, the demand far exceeds the supply of what the county has. The next allocation, this is according to a conference call that we just wrapped up with the county executive and his staff. The next allocation for the county is unknown, but there are facilities in and around the community here in Yorktown that do have the vaccine. However, it's important to know that there is no centralized list of who in our community has been provided with the vaccine. So I've received dozens of emails and phone calls today from residents from all corners of Yorktown asking where they can go to get the vaccine. Unfortunately, other than telling you the county center, which isn't open yet, I just don't know because we haven't been provided that information. As a reminder, the state continues to control all decision-making that's related to COVID, and that includes the vaccine. That allocation of vaccines to individual doctor offices, urgent cares, distribution points, so on and so forth. So again, here in local government, we're again the low man on the totem pole. So we are getting this information last and doing our best to get the information to all of you in the community. I want to just share my screen here and show, let's see if this one's it, and show the community dashboard. Nope, that's my Facebook page. I love how it does that. That's my wonderful family. So here's our community dashboard, and I just want to walk the residents of Yorktown through all of this because I want to show you this important resource that we have. Again, here's our new fancy website, yorktownny.org, and if you scroll down, you can see there's a couple things here I want you to notice. There's two boxes here. There's the Yorktown's coronavirus updates, and there's also the COVID-19 vaccination information. Earlier today, we circulated a letter by our county executive, George Latimer, that provided a lot of the detailed information that I just read to the residents. If you do not receive our emails, again, another important resource, come right here. How do I? Right on the top. And then it goes to subscribe, and you can subscribe to public notices. You can subscribe to Nixle community alerts, and that's for our PD, and you can subscribe to the monthly newsletter that we put out. But to receive these continuous updates, again, click public notices, and you can sign up to receive these emails. Another great feature that we utilize throughout the week as more information becomes available. So here's our update, our community impact dashboard. We were one of the first communities, if not the first, actually, to launch a community impact dashboard. And you can see here, there's a map of Yorktown broken down by zip code. I will say that the zip code count has not been updated as of yet. That'll be done momentarily. But you'll see on the side here, you'll see three boxes, including vaccine information. This is all the links that you need in order to get the facts, in order to, again, know if you're eligible, in order to take the county COVID survey. And also included on here is an important phone number. And this is beginning at 4 o'clock an hour ago, the state COVID-19 vaccination hotline for scheduling vaccination appointments. And you can call 1-833-NYS-4-VAX. That's 1-833-697-4829. I'll say it again. 1-833-697-4829. This is what we're being told is the best way for you to schedule your appointment to receive your vaccination. Also important to know that from people that we've heard from, the scheduling for the vaccination is already well into February. And as a reminder, you need 2 doses to be fully vaccinated. But the good news is the process is underway. We are getting more information as the state provides it and more accessibility for the residents of Yorktown. As I said earlier, the Westchester County Center will become a vaccine clinic. It is important and it is mandatory. I want to say this again. It is mandatory that you have an appointment. You cannot just walk in. I'll say it one more time. In order to get a vaccine from the County Department of Health, when they open the Westchester County Center as a vaccine clinic, you need to make an appointment. You will not be allowed to just walk in. And that's important for a number of reasons. Obviously from a supply standpoint, but as I just stated, you need to get the vaccine twice. There's a timeline for you to get the second vaccine, and it's all rolled in mechanically into the proper application for your vaccine. The bad news, and I continue to get questions on this as well, which I'm trying to address, as you can see on the left side of the screen, right over here, this is real. 82 new cases. That's Sunday and today. 82 new cases. That's the latest from the Department of Health. Really, it's Saturday and Sunday. And here's our number. 541 known individuals within the community who have tested positive for COVID-19 in the last 14 days. Again, you can see on the bottom there, active cases as of January 10th, yesterday. That's when the file shows. Again, we're going to update your zip codes there. It has not been updated since we got these numbers just a little while ago. But 82 new cases. And I continue to get asked the question, why aren't we an orange zone? Why aren't we a yellow zone? Why hasn't there been a cluster designation? As I stated earlier, and I'm going to state it again, New York State continues to control all decision-making related to COVID, including cluster designation. Now, it's not the legislature, and I want to thank both our state legislators for their continued support and great work, but it is the executive. It is the governor's office, the governor's staff, and the governor himself who are making these decisions. Now, for those who keep asking why hasn't there been a designation, fact of the matter is there has been an update on the cluster zone designations in quite some time, in weeks. And while people keep asking why haven't we been designated as a cluster zone, you also have the reverse happening in other communities who have already been designated a cluster zone, and they are trying to get out of the restrictions associated with cluster zone designation. But again, comes down to the governor, it comes down to the governor's office and the State Department of Health for designating cluster zone designation. And I hope, again, if anyone has any additional questions about that, you can always email me directly at mslater@yorktownny.org, or you can call me directly at 914-962-5722, extension 200. But I will just say one last thing about today's numbers. This is our 72nd video update. 72nd. We've brought in experts, we've brought in doctors, we've brought in hospital presidents. I don't really know who else I can bring in to convince people that this is real. This is happening. The numbers have gone up. And if you don't believe me, you can click right here on the graph and you can expand this and you can see right here just how far it's gone up. Here we are back on May 5th, May 4th, and here we are today. And you can see the roller coaster we've been on. You can see the fact that the holidays have clearly, as predicted, as every official we brought in predicted, has had a tremendous impact. You can see also, when we heard from the experts, national experts, state experts, county experts, the Commissioner of Health, everyone predicted January was going to be an awful month for COVID-19. Not just here in Yorktown, but across Westchester County, across New York State, and across the country. That's exactly what we're seeing. Again, we've brought every expert, and we're going to continue to do so, to continue to provide the important information. But the residents of Yorktown have had this information, have been educated on how to prevent the spread of COVID-19. You've been educated on it 71 times. And so when I get questions, well, how come the numbers keep going up? It comes down to individual decisions, responsible decisions, decisions that impact our entire community. And people ask again, well, is there any specific sector within our community, any businesses? I ask the same questions. And the answer is no. And the governor has shown you that. He has shown slides with 140,000 data points from across the state on all their contact tracing. And the number one spreader is living room spread. By far, 74%. It's not in our schools. It's not spreading in our schools. It's not spreading in the gyms. It's not spreading in our small businesses. It's spreading because of, frankly, poor decisions by people who I feel we've done everything we can to educate about COVID-19, about how to prevent the spread of COVID-19, and also who we've warned that through the holidays and into January, COVID-19 was expected to explode. And there's the graph. So if we want to get this under control, it comes down to individual responsibility, individual accountability, and smart choices. I can sit here for another 72 episodes and tell you to wear a mask, wash your hands, practice social distance. If you don't feel well, stay home. But I've been saying it for 72 episodes now. I'm not going to stop because I think it's important for people to be reminded, and I think it's important for the residents of Yorktown to have all the information to make the best decisions possible. But I can't make decisions for each and every individual within this community. I just can't do it. But I can give you the information and I can give you the direction. The rest of it is up to you. So if we want this graph to start going the other way, we need to make better decisions. In regards to the county, I'm just going to end on a few notes that we learned today. From Westchester County standpoint, there are now just about 10,900 active cases in Westchester County. That equals the active caseload that we had on April 10th. The only silver lining that we've seen, again, and this is an incredible tribute to the medical professionals who have been on the front line of this day in and day out. On April 10th, we had over 1,000 hospitalized. Today, that number is half. We now only have 500, and that's because our doctors, our nurses, our medical researchers have really done a phenomenal job in learning how to treat this more efficiently and more effectively. But that number is still up. 500 hospitalizations is still up considerably from where we were even just a week ago. So take it seriously. Do not lose your focus. Make smart, make responsible decisions. Remember, your actions impact our entire community. We're going to continue to provide updated information that's verified and accurate, as we have done since April. And I hope that the residents of Yorktown will actually take what we're giving you and make better decisions. I want to thank our frontliners. I want to thank our police. I want to thank our first responders and our EMS. They've continued to stand firm on the front lines. They've done a great job for this community. And we owe it to them to do better. And so, until we have more information, again, I hope the residents of Yorktown listen to this warning, listen to this plea of better decision making so that we can get this under control within our community and so that we can all get back to a life that we feel is more normal than what we have right now. So until then, stay well, stay healthy. We'll talk to you soon. Thank you.